We are all going through a unique, once-in-a-lifetime experience, which inevitably will change us all and our organizations.
Our team did not run away from the fire, but rather they ran toward it.
When we started doing testing, we could only do 1,000 tests per day, believe it or not. Today, we're doing 65,000 tests per day at 850 sites.
And one of the things that everyone has seen in this spring is how hard it is to be fast and flexible, how hard it is for our existing systems, medical systems, public health systems, supply chain, to really work fast.
So we launched 3 products that we would never even have thought of before the pandemic. One was the emergency relief bed, a very low-cost bed that could be assembled on site, that could be stored for stockpiles. That was designed and developed in 10 days.
A silver lining of this terrible crisis is that biology is moving forward in its science and understanding at a rate that's never been seen before.
We have an extraordinarily well-funded biomedical enterprise here in the United States, second to none. We have the finest scientists in the world, second to none.
I can tell you that this is unprecedented in how many companies and the type of investments it's been made, not only to develop the vaccine, which is important, but also to be able to manufacture the vaccine in sufficient quantities so we can vaccinate billions of people.
Your collaborations and partnerships will elevate the field of health innovation tremendously.
Great science combined with great health care and great leadership defeats viruses.
New York could not have gotten through this pandemic without Northwell, period.
We cannot let this crisis go to waste. Instead, we must remember it, learn from it, so that we don't relive it. I thank you again for attending this important conference and hope we can continue to find ways to work together.